All right, so you wanted to explore this connection between diabetes and hypertension. We found this article called Hypertension and Diabetes, a perfect storm of health risks and how to weather it. And just the title alone is kind of intriguing. Like, it's not just about managing two separate conditions, is it? It seems like they impact each other.
Yeah, definitely. There's a synergy there that makes the risks even greater.
So before we get into the specifics, can we start with the basics? The article talks about hypertension being this silent killer, which honestly sounds kind of scary. What is hypertension exactly? And why don't people know they have it?
Well, that's a great place to start. You can think of your blood vessels as a network of pipes, just like your plumbing at home. Hypertension is essentially when the pressure of blood flowing through those pipes is too high. And the problem is, just like plumbing, that high pressure can cause damage over time without any noticeable symptoms. That's why it's called the silent killer. A lot of people only find out they have it when something serious happens, like a heart attack or a stroke.
Yeah, that makes sense thinking about it like that. But how does high pressure actually damage the blood vessels? That's what I'm kind of curious about.
Well, imagine water constantly pounding against the inside of a pipe. Eventually, that pipe is going to weaken and potentially even burst. The same thing can happen with your blood vessels. High blood pressure damages that delicate lining of your arteries, making them more susceptible to plaque buildup, hardening, and even rupture.
Okay. So the article says 60 to 70% of people with diabetes also have high blood pressure. What's the link there? Is it just bad luck or?
It's definitely not just bad luck. There are some shared root causes that make these two conditions such frequent companions.
So let's talk about those. Starting with insulin resistance. The article mentions that, but I always associate that with blood sugar, not blood pressure.
Yeah, that's a common misconception. Insulin resistance actually affects both blood sugar and blood pressure regulation. When your body doesn't respond to insulin properly, it can lead to a buildup of glucose in the blood, which we know is the hallmark of diabetes. But it also messes with your body's ability to manage sodium and water balance.
So more than just blood sugar problems, insulin resistance is impacting my whole system.
Precisely. That increased fluid volume from retaining sodium and water puts more stress on your blood vessels, leading to, you guessed it, higher blood pressure.
Wow. It really drives home the point that people with diabetes are twice as likely to have high blood pressure.
Meh.
What other connections are there?
Well, inflammation is another major player in both diabetes and hypertension. Chronic inflammation can damage the lining of your blood vessels, making them stiffer and narrower. This narrowing forces blood to push through with more force, which raises the pressure.
Oh, so it's not just about the volume of blood, but also the space it has to flow through?
Exactly. And of course, we can't forget about obesity. Excess weight, especially around the abdomen, contributes to both insulin resistance and increased blood volume, putting a strain on the heart and driving up blood pressure.
It's all starting to feel very interconnected. The article also mentioned something called diabetic nephropathy, kidney damage related to diabetes. How does that tie in?
This is where things get particularly concerning. The kidneys play a critical role in regulating blood pressure. When diabetes damages the kidneys, which is what happens with diabetic nephropathy, they become less effective at doing their job. This can lead to a vicious cycle where high blood pressure further damages the kidneys, and those damaged kidneys in turn contribute to even higher blood pressure.
That sounds pretty serious.
It is, and that's why understanding this connection between diabetes and hypertension is so important. We've got to address both conditions proactively to prevent that kind of cascading damage. So we've talked about how diabetes and hypertension are linked and how serious it can be. But the good news is that we can do something about it. There's a lot we can do to manage hypertension, and a lot of those strategies also benefit blood sugar control.
Okay, good. So I don't need like two separate plans, right?
Not at all. A lot of the same lifestyle choices that help with diabetes also have a positive impact on blood pressure.
Like what?
Well, regular blood pressure monitoring is key. You can do this at home or at your doctor's office.
The article says to aim for below 130/80 millimole Hg. Is that a good target for everyone?
That's a good general guideline, but your doctor can give you a more personalized recommendation.
Okay, so monitoring first. What else?
One of the most powerful tools we have is diet. The article specifically mentions the DASH diet, which focuses on fruits, vegetables, whole grains, lean proteins, and low-fat dairy.
Yeah, I've heard of the DS diet. Isn't that mainly for blood pressure?
It is, but it also aligns perfectly with what's recommended for managing diabetes.
So win-win.
Exactly. It's all about making healthy choices that benefit both conditions.
So what makes the DS diet so effective?
It's low in sodium, which is a major contributor to high blood pressure. When you eat a lot of sodium, your body holds on to more water, increasing your blood volume and putting more pressure on your blood vessels.
So less salt, less water, lower blood pressure.
Right. Aim for less than 1,500 milligrams of sodium per day.
That sounds kind of hard. Any tips?
Cooking at home more often is a great way to control your sodium intake, and look for low-sodium options at the grocery store.
Makes sense. What about easy swaps?
Sure. Choose fresh or frozen fruits and veggies over canned varieties, which often have a lot of added sodium. And instead of using salt, try different herbs and spices to add flavor.
Love that. More flavor. Besides watching sodium, are there any foods I should be eating more of?
You can increase your potassium intake. Potassium actually helps to counter the effects of sodium and can help lower blood pressure.
What are some good sources of potassium?
Foods like bananas, sweet potatoes, avocados, spinach, and beans are all excellent sources.
Okay, so we've got monitoring, diet. The article also mentions exercise, which
Right.
I know is good for everything, but how does it specifically help with hypertension and diabetes?
Exercise strengthens your heart, improves blood flow, and helps lower blood pressure. Plus, it increases your insulin sensitivity, meaning your body can use insulin more effectively.
So exercise is a two-for-one deal.
Exactly. Aim for at least 30 minutes of moderate intensity exercise on most days of the week.
Okay. The article also mentions HIIT. Is that something I should be doing?
HIIT can be very effective for both blood pressure and blood sugar control, but it's more intense. It involves alternating between short bursts of high-intensity exercise and periods of rest.
Is it safe for everyone?
It's always a good idea to talk to your doctor before starting any new exercise program. They can help you determine what's safe and appropriate.
Okay. And the article emphasizes that even a small amount of weight loss can have a big impact. Is that true?
Absolutely. Losing even 5–10% of your body weight can lower your blood pressure and improve your insulin sensitivity.
Okay, that's encouraging.
Small changes add up over time. And the article also highlights the importance of limiting alcohol and quitting smoking.
I know those are good for health in general, but what's the specific connection to blood pressure?
Smoking damages your blood vessels and raises your risk of heart disease and stroke. And excessive alcohol intake can raise your blood pressure.
So everything in moderation.
Exactly.
We've covered a lot with lifestyle changes. What if those aren't enough to manage blood pressure? The article mentions medication. What about that?
If lifestyle changes aren't bringing your blood pressure down to a healthy range, your doctor might recommend medication. There are different types of blood pressure medications.
It's hard to figure out which one is right. What questions should I ask my doctor?
You should definitely ask your doctor about how the medication works, potential side effects, and any interactions it might have.
Be informed. Ask questions. Got it. What are some of the types of blood pressure medication out there?
Some common ones are ACE inhibitors, ARBs, calcium channel blockers, and diuretics.
Can you break those down for me?
ACE inhibitors and ARBs relax your blood vessels. Calcium channel blockers also relax blood vessels, but do so by blocking calcium. And diuretics help your body get rid of excess sodium and water, which lowers blood volume and pressure.
So different approaches, and my doctor can help me find what's best for me.
Exactly.
We haven't talked much about stress. Is that a factor?
Absolutely. Chronic stress can definitely contribute to high blood pressure. When you're stressed, your body releases hormones that cause your heart rate and blood pressure to spike.
So stress management is important too.
It's about finding healthy ways to cope with stress, like deep breathing, yoga, meditation, spending time in nature, anything that helps you relax.
Finding what works for you. So we have a lot of options for managing hypertension.
We do. And remember that these strategies aren't just about managing hypertension. They're about promoting overall health.
A holistic approach. Before we move on, is there anything I can do to prevent hypertension from developing, especially since I have diabetes?
That's a great question. A lot of the strategies we've talked about, eating a healthy diet, exercising, maintaining a healthy weight, managing stress, avoiding smoking, and moderating alcohol, also play a key role in prevention.
So being proactive.
Exactly.
This has been so helpful. I feel much more informed and ready to take charge of my health. But making changes can be tough. Any advice for someone feeling overwhelmed?
It's understandable to feel overwhelmed. My advice: start small. Pick one thing you can change this week. Focus on making that change a habit. Once that feels good, add in another small change. Those small changes can lead to big results over time.
Small steps. Consistency. I like that.
Exactly. And you don't have to go it alone. Lean on your support system. Talk to your healthcare providers. There are so many resources out there to help.
This deep dive has been amazing. I feel so much more informed and honestly a bit more motivated to take charge of my own health.
It's been my pleasure. Knowledge is the first step. but action is what makes the difference. Take what you've learned and make positive changes in your life.
And remember, even those small changes can have a big impact on your health. You got this. Until next time, stay curious and stay well.